Good afternoon. We will now start our pep talk. As a reminder, please mute yourself but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. So please show your faces in the video. Another reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. Another reminder, 50 ALET certificates will entitle one mentee or participant to a voucher for an ROJoson telemedical consultation. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now, show your faces. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Epidermal Cysts in Skin. The empowerment objective is for the lay people to have an essential understanding of epidermal cysts in their health management. The contents of this pep talk will be the following. What is an epidermal cyst in the skin? What is the hypothesized cause of epidermal cyst? What are the differences among sebaceous and epidermal cysts and acne? Where are epidermal cysts commonly located? What is the most common complication of epidermal cysts if not treated? How to recognize and diagnose epidermal cysts? What is the treatment of epidermal cysts? And do epidermal cysts recur after an operation? A disclaimer, ROJoson PEP Talk contains ROJoson's thoughts, perceptions, opinions, and recommendations, or TPORs, culled from the experiences of other professionals and ROJoson himself. What is an epidermal cyst in the skin? An epidermal cyst is a palpable mass located just beneath the epidermal layer of the skin that contains a capsule and inside of which are cheesy, oily, greasy, keratin material or skin element. In majority of epidermal cysts, there is a punctum here, a dark colored point or spot, which represents a plug opening. This shows the capsule containing the greasy materials, grayish, oily substances, which are actually skin elements. What is the hypothesized cause of epidermal cyst? Most epidermal cysts are caused by implantation of epidermal elements into the dermis. Implantation of the epidermal elements here into the dermis. This is the dermal layer. When the skin or epidermal cells move under the skin surface or are covered by it, instead of shedding, going out. Okay. So these cells continue to multiply inside the skin, just like any skin normally do. They do multiply. Then they form a wall around themselves. This is the wall, the capsule, and secretes normal skin fluids or keratin. So this is the content. This is the capsule. This shows the implantation. To illustrate further, so this is the punctum here will be the point of implantation of the epidermal elements, okay? And then there is a cyst that is lined by epidermis, similar to that of the skin here. It forms a capsule, and then the inside content will be the keratin materials or skin secretions. Some terminologies that have to be explained. Oftentimes, doctors use the phrase sebaceous cyst, referring to epidermal cyst, which is strictly speaking not correct anymore. If the cyst contains keratin substance, then the proper term is epidermal cyst or epidermoid cyst or epidermal inclusion cyst. These three terms are all the same. If the cyst contains sebaceous substance, then the proper term is sebaceous cyst. What is more common is the epidermal or epidermal inclusion cyst rather than the sebaceous cyst. The term milia refers to very small superficial epidermal cyst, milia. Acne and pimples are not the same as epidermal cyst. Okay. So this one shows the epidermal cyst, the mass just beneath the skin with the punctum, whereas acne are clogged skin pores. It can present either as blackhead, okay, or whitehead. Where are epidermal cysts commonly located? Although most commonly located on the face, the neck, and the trunk, epidermal cysts can form anywhere in the body, anywhere. What is the most common complication of epidermal cysts if not treated? Infection. Okay. Showing the redness and the swelling, and then pus exuding out. Okay. So infection. How to recognize and diagnose epidermal cyst? The pattern recognition for this will be a lump or a mass just beneath the skin with a punctum. Okay. So once you have a punctum, it's a giveaway already, okay, that it is an epidermal cyst that you are dealing with. So this mass, this epidermal cyst can occur anywhere in the body. What is the treatment for epidermal cysts? There are three options: watchful waiting, incision and drainage, and excision. For watchful waiting, one can usually leave a cyst alone, especially if small, especially if it's less than 1 centimeter, if it does not cause discomfort or cosmetic problems. An option in the treatment is incision and drainage, in which a small cut is placed on the skin over the cyst, and then the contents are gently squeezed out without removing the capsule. Since the capsule is not removed, there is a high risk for recurrence, so it may recur. The last type of treatment will be the excision, in which the whole cyst is removed together with the capsule. Okay. So in this case, since the capsule has been removed, there is a lesser chance for recurrence. Do epidermal cysts recur after an operation? Yes. Epidermal cysts can or often recur with incision and drainage. The second type, the type of operation in which there's a small incision and then the capsule is not removed. Now, if an excision is done, It can recur, but it recur less often. Operations for epidermal cyst, some pictures. Okay, so this is the epidermal cyst with the punctum, the mass there, and then this shows the whole cyst have been removed. It has been removed, and the capsule, the whole thing, the capsule, the inside of which is the content, the greasy material. Okay. So this is the epidermal cyst. This is the punctum, a small incision, showing the epidermal cyst inside, and then removal of the epidermal cyst. Okay. Another picture, set of pictures, epidermal cyst, small incision over the cyst, removal of the cyst together with the entire capsule. So a small incision, which is possible. Okay. So epidermal cyst on the breast area, but this is not epidermal cyst of the breast. This is still epidermal cyst in the skin. Okay, showing the epidermal cyst here being removed. The whole the cyst itself, and then the content. Okay. So there's a this picture shows discrete superficial intradermal mass with an opening or punctum here. Okay. And then there is redness, erythema, suggestive of inflammation or infection. Okay. Showing some pus coming out, suggestive of infection. And then, as the cyst is being excised under local anesthesia, okay, remove. Okay, so the well-encapsulated cyst is shown here, and then these are the greasy content. Okay. So epidermal cyst is not common in the breast area, but it can occur there. So epidermal cyst should not be mistaken for a breast cancer, and treatment of epidermal cyst on the breast area is an excision. More pictures, squeezing out the content through the punctum, the opening, without removal of the capsule. As mentioned, this is the so-called incision and drainage. There is a higher chance of recurrence compared to excision of the entire capsule and the cyst. Epidermal cyst on the face, bigger one. Nostril, finger, shoulder, chest wall. It can occur anywhere. Okay. So summary and takeaway, I have discussed the following. What is an epidermal cyst on the skin? What is the hypothesized cause of epidermal cysts? What are the differences among sebaceous cysts, epidermal cysts, and acne? Where are epidermal cysts commonly located? What is the most common complication of epidermal cysts if not treated? How to recognize and diagnose epidermal cysts? What is the treatment of epidermal cysts? And lastly, do epidermal cysts recur after an operation? Takeaway in relation to patient empowerment: be always in touch with reliable medical information on epidermal cysts. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on epidermal cysts in your health management. With that, I end my pep talk. I hope I have empowered you to have a better understanding of epidermal cysts in your health management. Before we go to the question and answers session, as a reminder, please take the Olete. Obtaining 50 Olete certificates entitled 1 Mentee to a voucher for a ROJoson telemedical consultation. Requests, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the QA and interactions. Please turn on your video and show your faces.